guys. Welcome to our online classroom. We're going to jump right back in where we left off talking about diabetes. So this will link up and match up with the lecture we completed previously. We're just kind of jumping in here at the medical considerations part of it. So we have already talked about the overview, how many people are affected by diabetes, the pathophysiology, how it develops over time. So now let's talk about some medical considerations for prescribing exercise and medical considerations to keep in mind as you're working with these patients. So what are some signs and symptoms? Now, this is going to be a little bit of a review. We left off here. We left off a little bit after this point, but I wanted to make sure that we could remember everything we talked about that last day of class. So as a reminder, our signs and symptoms of diabetes are polydipsia. That's when folks are very thirsty. We've got some play going on in the background, guys. I apologize for the noise. Hey, Zach, let's try to be local. Okay. No, he said no. So we'll see how well we do here. So remember, due to the high concentration of glucose molecules in the blood, the body's trying to even that out by intaking more water and decreasing the concentration of glucose. So folks with diabetes are going to be very thirsty. They're going to have to urinate frequently because they have that increased water intake, and also because the kidneys are trying to help you get rid of all that extra glucose. We're going to have unexplained weight loss as folks are not able to absorb the glucose they're eating. We're going to have infections and cuts that are slow to heal, and folks are also going to be fatigued. So that an infection, thank you, sweetheart. Zach just brought me my cheek, guys. He's so sweet. So infections and cuts that are slow to heal because a high level of blood sugar is going to make it difficult to heal those, and we're also going to have some potential narrowing of the blood vessels. And then fatigue as folks aren't able to create the energy they need because they're not able to bring blood sugar. Oh, all my cups. All my cups. You can bring that over here. Thank you, sweetheart. Oh, Zach, y'all. Zach's worth I'm thirsty. Thank you, buddy. Okay, good job. All right. What else? What else? What else? Okay, blurry vision due to potentially onsetting eye problems with retinopathy. And then glycosuria, the sweet taste in urine. We have that high sugar content in the urine because we are urinating out a lot of sugar. And remember, we talked about Thomas Willis, who discovered this, who was the first person to add the word mellitus, the word diabetes, meaning that folks were urinating a lot and there's a sweet tasting, there's a sweet taste to their urine. But this had been noted by multiple other cultures beforehand, and now we know that where that sweet taste is coming from. So our ACSM recommends a medical exam and a clinical exercise test before folks participate in moderate and vigorous intensity exercise. And we're going to ask for physician clearance, but we also, as exercise physiologists, are responsible for getting that exercise clearance. When you're reviewing their health history, you want to look for acute and chronic complications. So do they have hypo or hyperglycemia? Do they have retinopathy, neuropathy, macrovascular disease like heart attack, for example? Do they have a high HbA1c level? So HbA1c is, oh boy, I should have typed this for you guys. Let me see if I can use the pen. Although, actually, you know what? Hang on a second. I'm going to type it right into this slide while I'm recording. Okay, so HbA1c is also known as, let's see here, glycosylated hemoglobin. What that means, look at that. Adding notes as we go. Bam. So glycosylated hemoglobins, remember hemoglobin is that molecule found in red blood cells that contains iron that binds oxygen. So over time, let's get back to that. Over time, with that high level of blood sugar, we're going to get a little glycosylation or a glycogen tag kind of attached to that hemoglobin, and it shows we have a high level of blood sugar over time. So that's a long-term level of high blood sugar, long-term measure of diabetes. We have plasma glucose, high plasma glucose. We're going to test for lipids and proteinuria as well. I'm concerned about lipids because they may have metabolic syndrome, which also involves having high lipids. I'm also worried about cardiovascular disease risk if they don't already have cardiovascular disease. I'm going to check their blood pressure because I want to make sure that they don't also have hypertension. If they have hypertension and diabetes, man, I am really concerned about that because we've got a lot of things kind of heading us down the path of cardiovascular disease as a kind of secondary as a result of diabetes. I also want to make sure that they're monitoring their own blood glucose results so that they are. Excuse me, sorry guys. A lot of early mornings and late nights working on these classes. I'm sure you guys are experiencing that thing as well. Zach, please shush. So I want to make sure that my folks are monitoring their own blood glucose on a regular basis because that's really important. So I know that they're checking their blood sugar daily or multiple times a day. They're eating the right things, taking their medication when they need to, and they are also able to adjust as needed and report that back to me. I also know that their body weight and BMI are important, right? We've talked about this. Obesity is a risk factor for diabetes, and it goes along with diabetes a lot of the time. So if they are obese, I do want them working to decrease that weight with exercise and diet. I also want to look at the medications you're using, what the timing is for that. So I don't double them up and have them take their medication, then exercise right away. That could lead to hypoglycemia, which is a big problem for them. What's their exercise history? Are these people that have enjoyed exercising in the past? Do they have different things they like to do? Or have they maybe never exercised and I've got to kind of educate them on how to exercise? It's quite possible that'll be the case. And maybe that they really used to enjoy exercise and they just haven't done it recently. But it might be that they are exercising and they need some guidance on how to do so safely with their diabetes. And maybe that they haven't never exercised before to any great extent and you really need to help them build that habit. So of course that can change from person to person. But it's important information to get ahead of time. I want to know what's their nutrition plan, particularly timing, amount, and the type of most recent food intake. Okay. I also want to know if they have other non-diabetes related health issues. That's a really good job, buddy. Now, what's the treatment for diabetes going to be? It's going to be holistic, right? We've got to look at a lot of different parts of their lives. We want them exercising, both aerobic and resistance training. Because it's going to help to manage their blood sugar in a few different ways. I also need them to be in a nutrition therapy and diabetes self-management education program with a dietitian. Because I can't handle all of that. I'm not going to be, as an exercise physiologist, not really qualified to give dietary advice other than the basics of how to eat healthfully. And they're going to need to have a really strong level of education in that arena, the arena of nutrition or diabetes, and that's really done well by a dietitian or a diabetes educator. Or a health coach is another great example of a person who could do that. I want to make sure they are self-monitoring their blood glucose, as we said, and then I want to know what those numbers are. And I want them to be on their medication if and when they need it. So some common treatments for diabetes include insulin for type 1 patients, and then oral hypoglycemics, which are pills they're going to take. So insulin is injectable. It's that hormone analog, which means a synthetic version of a hormone that we make as humans. And they're going to inject that directly. And that's going to take blood sugar down pretty quickly in a pretty strong manner. And some type 2, but not all type 2 diabetics will be taking that. Hold on. Yes, buddy. Oral hypoglycemics are where type 2 diabetic patients are going to start. Don't mess with those blinds, okay? Sorry, guys. Oh, it's just crazy around here. Okay, so we're also be taking oral hypoglycemics for type 2. So these are pills. They're not going to be as quickly acting. That's actually a good thing. It gives us a kind of a more even response, and they're not as strong. Insulin has a lot of side effects that, while it's a necessary drug for folks who are really in pretty bad shape with their diabetes or type 1 who don't make it, it's starting on these kind of lower level drugs, sulfonylureas, metformin, that's going to break if you stand on it. And thiazolidinediones, right? Can we all say that 3 times fast? Uh-oh. Okay, I'll get Spider-Man in a minute. Guys, Spider-Man's stuck in his web. It's pretty tough. It's tough though. We'll get him in a minute, okay? Now, if a person's taking insulin, we want to be really careful. Insulin is the principal hormone that regulates glucose use, and primarily type 1 diabetics are going to be taking insulin, but you may have a person, I've worked with folks who had very advanced type 2 diabetes who were also on insulin. Insulin can lead to hypoglycemia or low blood sugar, can also lead to weight gain. So what do we need to watch out for when a person is taking insulin? Well, if they are using the leg as an injection site, we don't want to strenuously exercise the legs right after an injection. We also want to find out when is it that insulin kind of really starts to work, and I don't want them to also be exercising when that insulin really starts to work hard. So one example, or a little picture, we already talked about that though. Diabetics exercise should be careful to avoid injecting insulin close to muscles which are loosely exercised. And you may have some folks who are on insulin pumps that will usually be in the abdomen. Oh, and an insulin pump is like a little small device that stores insulin, and you check your blood sugar, and then you type into the little pump that you're wearing on your waistband how much insulin you need, and then it does that for you. So you don't have to constantly inject insulin. It's just kind of running into your body, and it's a little bit easier for folks to deal with. So oral hypoglycemics are used for treatment of type 2 diabetes. They don't directly affect exercise capacity, but if they take them incorrectly, they can cause hypoglycemia. This is a problem because if a person becomes hypoglycemic and then exercises, that hypoglycemia can become very bad and can endanger their life. So we're going to always make sure to test for blood sugar before exercise. And I'm going to jump out again here. I normally write this on the board, but I'm going to type it on here for you. So we're going to test blood sugar before exercise. So say test BS is blood sugar before exercise. We want it to be between, we want to be between 100 and 300. 300. There we go. If it's below 100, we're going to give them a glucose type of snack. We're going to give them a glucose type of snack, and we're going to wait 15 minutes and test again. If it's above 300, I want them to call their doctor because that's hyperglycemia, and that can be made worse by exercise, because when we start to exercise, our body releases stored glycogen from the liver and the muscle, which can temporarily spike your blood sugar. It's a little bit of a surprise effect sometimes, but that's why we don't want folks exercising in a hyperglycemic state, because it can make it even worse. Exercise testing for folks with diabetes, we want to consider their age, how long they've had diabetes, and the presence of complications. Since we have a high risk for cardiovascular disease, we want to have a low-level treadmill or cycle arm ergometer, so an arm crank or a regular bike for a lot of folks who have diabetes. So we're going to be a little bit more restrictive with our type of testing for folks who had diabetes for a while and may have that pre-existing disease. So if you had type 2 diabetes and you have type 1 and you're over 30 years of age, you've had diabetes for a long time, there's potentially quite a bit of damage to your vascular system. So we're going to be very careful with testing. And that's just one example of that. Okay, I'll give you the other two examples. I got a couple minutes left on my recorder. If a person's type 2 and over 35, or they're type 1 and 2, plus they have another coronary artery disease risk factor, that can also predispose them to, as we know, have cardiovascular disease. So we want to be extra careful for those. All right, guys, thanks for hanging in. I know it's a little noisy today. We're just going to have to do the best we can to get through all this. And hop on over to Canvas. There's going to be a short assignment for you to complete to go along with this. And catch you next time, guys. Everybody stay safe, wash your hands, etc., etc., and we'll talk to y'all soon. Bye.